To Channel 6 News, and we have the pleasure of having Dr. Farmond with us in the studio today. Welcome back.
Thank you, Rob.
A little bit about your background and your practice here locally.
It's a pleasure to see you again, thank you for having me at your show again. I'm Dr. Farmond, practicing over 14 years here in U.S. and have my office at the cross-section of Lake Forest and Carlotta near Gate 6, and I have the pleasure to give services to the community of Laguna Woods Village, and I'm here to introduce a very, very interesting case.
Yes, you brought one of your patients along with you. Introduce her if you would, please.
Her name is Joyce Myers, and I'm very proud of this case, and that's why I would like to present this case today.
Great. You know, no two mouths are alike, obviously, as you're finding in your practice, and everybody has different issues. Joyce, a little bit about why you came, first of all, how you came to Dr. Farmond, and then specifically what you were concerned about.
I had a problem with my old dentures and was referred to Dr. Farmond by a bowling acquaintance, and she was very pleased with her. So we had I went to Dr. Farmond and we had new dentures, but as always, I've had lower dentures for 40 years in the bottom, and it never fit right. They do the best they can. So she suggested this procedure, which I am so thrilled with.
You know, obviously, having dealt with it for 40 years, technology has changed and improved. A little bit about how you address the situation.
Rob, the concept is that a lot of people around us, they're walking around with the dentures and they think, oh my God, this is my, the only solution that I have is putting a little bit, denture paste underneath, and I'm keeping them in the place that way.
Right.
But that's not what we do right now, and what we suggest, and that's not the standard of care anymore. We tell the patients there is another way to fix that and regain the retention that we need in the lower jaw to keep the denture in place. We're
looking at a series of pictures here, and I guess starting with the upper left one here, that's what we call implants.
Yes.
And that is, while it's not brand new technology, it was certainly something that you hadn't approached and thought about, Joyce, correct?
That's right.
But doctor, actually you've been doing this in practice for years now. It's been the common practice. Some folks are having just one tooth. Some are having multiple teeth. In this case, two solve the problem. Two
solve the problem completely. Two solve the problem. Whatever problem she was talking about rocking the denture and tilting the patient is gone. She's telling me that she's so happy she can bite on anything that she wants to. And with the extra machine that I have in my office, the panoramic X-ray, I could measure her bone and see exactly where the implants they need to be placed. And that's it. And then we are putting two attachments on the back side of the denture, and the dentures is locking onto these two posts, and that's it. And
okay. So we don't want to get too graphic here, but basically this is permanent.
Yes.
Even if you do remove your dentures for cleaning, those two posts, I guess you call them, or whatever you call them, but those two are anchor points.
Yes.
And I bet you're surprised and happy.
I'm thrilled. And may I just say one thing? When I clean my teeth in the morning, I was so used to taking that paste and putting in. After I clean my teeth now, I'm still looking for the paste, and I don't need it.
Yeah.
They just click in, and that is it, and they are solid.
That's great. That's great. Now, they tell us we should eat a variety of foods, and I would imagine with the slippage problem you had, perhaps you were limited in what you could eat.
I was. Apples now.
Carrots.
Carrots.
Yeah.
I'll tell you, anything with seeds too.
Oh,
that was a very big problem.
Yeah.
So.
Well, we feel bad for the paste makers because you've lessened their income, but we're very happy for you that you've now gotten some good results. Dr. Farmond, obviously Joyce's case was unique, but really that's your philosophy. Each patient is unique.
Each patient is unique. exactly right, Rob. You know, I have to examine the patient. That's the message to every resident here in Laguna Woods Village. Please call us and make a free consultation appointment. I will take a look at the case, and if I can help you, I will do it the same way that I did here. You don't know, Rob, how good it feels when a patient tells you that you are a miracle worker.
Right,
It's amazing.
In addition to the miracles that you work, you also provide traditional things like cleaning and x-rays and exams and all that as well.
Yes, I do.
Right, so full service dentistry.
I do.
That's
I have the
very
honor to provide all these services to the village.
That's great. Right near gate 6, I believe you said,
Yes.
right here in Laguna Woods, so nearby to our folks here. And if you want more information, you can give them a call over there. We've got the number on the screen, 716-7166, and you can find out more about the good services they provide. And you know, that's one thing that I think is always good, is to have, no pun intended, word of mouth recommendation from your bowling companion there,
Yes.
recommending Dr. Faramond for you. And we're so happy that you're happy. And the apple and the celery people are happy as well.
Yes.
The paste people are sad, but that's their loss, I guess. Dr. Faramond, thank you so much for joining us and bringing Joyce by. I appreciate it. Good to have you with us today on the show. If you want to find out more about the good dental care they provide over there, give them a call, 716-7166, and you can get answers to your specific questions as well. And